You must start. And one more important thing I would like to show you at the end of the day. There was a quadriplegic patient who did not stand for 4 years. His, his 4 photos are there, and today you can see he is walking. So you can see that. And let me teach you much about the injection therapy. I'll teach you much easier method also with dextrose saline. So you don't need to use any chemicals and all.
So no need of Papa?
No, Papa. I'm trying to make things more simple. See, the thing is that, what do you mean by research? You know, once upon a time, I thought there is only one type of stem cell we can develop, but with the help of the same machine, I understood. After doing my angiography, the hole which was there, you know, in how many days I revived? One day. It was revived. My blood pressure was 20 and I became, tropopin was given for how many? 6 hours. And not even 6 hours, 4 hours. Withdrawn, and then I'm back. They observed me and they saved me back. Next day, 9 o'clock discharge. What will you say? See, our purpose is what? To recover those patients who cannot be recovered. I've only seen in ICU people dying with more medicines than what? Recovery. This boy could not even today we went for a KFO. He said, I cannot lock my knees. And today, independently, he was locking his knees without holding anyone. And he is quadriplegic at C5, C6 level. There are 4 things which we must understand in this situation. Write down. One is neuropathic condition. The neural condition has to be defined. So this time I went step by step. I recovered this neuropathic condition of his leg and hand so that he can hold. Right? Third, interneural communication I started doing. Fourth, today I made him stand. And he was independently standing for more than 5 minutes. After 4 years, he could independently stand. You could see his video also. Will you like to see his video at first or will you see his video at last? Will you like
Now,
to
sir,
see
now.
go to my Facebook, you will see. You will see that.
Can you repeat the 4th step you're saying?
So the first step is, first, whenever there is a paralysis, see what is the problem? Why you cannot recover paralysis? First tell me why you cannot recover. Because whenever there is a paralysis, it's a neuropathic symptom. Neuropathic means there is no conduction in the nerve. If there is no conduction in the nerve, there are neurotransmitters which are required to formation of the neuroconduction in the nerve is not formed. So how the muscles will move?
You are right, sir.
You see, this is the first photo, and you can see the last photo. Last video. Patient, we are at Hyderabad, sastri. You can see this was a bedridden patient who came from Calcutta and he was totally packed. I'll show you his previous photo also. And today you can see the patient is self-standing and you can see minimal support. Beautiful. There is no support in the knee. हाँ हटाओ हाथ ऊपर करो हाँ
कोई नहीं हटाया है सपोर्ट है पीछे
ऊपर को you are standing alone बेटा
नहीं
you can see there is no buckling in the knees and you see his previous photos. कमेंट बोलो अपना आप बना हाँ कमेंट बोलो क्या बताओ कैसा लग रहा है
अभी तो ठीक लग रहा है मतलब बहुत अच्छा लग रहा है
अभी थोड़ा सा move करो हल्का
हाँ
फीलिंग्स टू गुड
तुम बोला था कि तुम अभी खड़ा हो जाएगा स्वास्थ्य वाले रूम में क्या लग रहा था तुमको छोड़ो जरूरत नहीं है ये विल नॉट फॉल जैसे फॉल करे सपोर्ट करो बस कुछ नहीं है हाथ ऊपर रखो यू कैन सी दिस इज स्पाइनल सर्वाइकल कॉर्ड इंजरी कौन सा लेवल पे हुआ था C5 C6 लेवल का सर्वाइकल कॉर्ड इंजरी पेशेंट नाउ यू कैन सी इज स्टैंडिंग एंड यू कैन सी इज विद द हेल्प ऑफ स्टेम सेल थेरेपी हाथ को हटा के रखो नहीं तो लोगों का ऐसे रखो और शुड बी ये तुम बिना केएफ के खड़ा हो गया बिना मतलब का केएफ बनवाया हमको
ये हाथ में अगर ग्रिप आ जाएगा तो और भी अच्छा
वो तो आ जाएगा अब तुम खड़ा हो गया ना अब पूरा पावर बॉडी खुद ले लेगा मसल्स पावर ले लेगा सबसे पहला बात तो तुम व्हील चेयर पे सकते अब तुम पहली बार खड़ा हुआ डोंट वरी ये इंजरी कैसे हुआ था
कार एक्सीडेंट से
हाँ। बिना बैक सपोर्ट बिना किसी सपोर्ट बिना पाए पुई के खड़ा हो गया तो विदाउट नी लॉक ये देखो ये stood up for the first time after 4 years अभी कितना आदमी चाहिए
खड़ा होने के बाद
हाँ अब
अभी तो कुछ नहीं अभी तो मैं अकेला
you go see his first photo and now you can see this video नी थोड़ा बकलिंग हो रहा है क्या हाँ बैक तुम पीछे जा रहा है वो तुमको बोल रहा था ना बैक पीछे जाएगा गया बैक पीछे आने दो थोड़ा तो 15 दिन बाद खड़ा हुआ चक्कर तो आएगा व्हीलचेयर को खड़ा हुआ कैसा लग रहा है
अच्छा लग रहा है
आगे ऐसे खड़ा होने में कितना सपोर्ट चाहिए था
ये 2-3 मिनिमम 2 लगता है
मिनिमम 2 काम पकड़ना पड़ता था
कंधे पे और
नी पे अब नी पे कितना है
कुछ नहीं
हाँ
कुछ नहीं
नी सपोर्ट है
नहीं
हाँ
कुछ नहीं है नो प्रॉब्लम
कुछ भी होगा नीचे बैठ जाना खड़ा रहो क्वाड्रिप्लेजिक पेशेंट है तुम बेटा क्वाड्रिप्लेजिक तुम क्वाड्रिप्लेजिक से ये स्टेज में आ गया क्या चाहिए तुमको You could see with the help of stem cell therapy, regular treatment, you can see.
हाँ बैठा
हाँ बस बैठा तो आराम से अब बताओ तुम कितना ऐसे ऐसे हुआ ऐसे हुआ, तुम बोला ना ऐसे हो जाएगा, ऐसे हो जाएगा, इसे पीछे का बांधना पड़ेगा। हाँ
एफर्ट तो लगाना पड़ेगा उसको।
नहीं नहीं, ऐसा बांधना पड़ेगा, वैसा बांधना पड़ेगा, अब लगता है तुमको?
नहीं सर ऐसे चला है।
हाँ, हमको तो इसका भी जरूरत नहीं लगता। क्या बोलता है?
केएफओ
केएफओ
अब एक
और
आधे
केएफओ,
आ गए।
हाँ नहीं केएफओ, हाँ क्यों नहीं लोग हो गया बेटा।
ये नहीं लोग तो होता है,
हाँ हाँ
हम लोग 2 आदमी खड़ा करता है।
नहीं नहीं, वो आप लोग जो करता है उसमें बकलिंग होता है, बकलिंग होता है। आप
So
लोग
they
जिस
are
तरह से
saying
खड़ा करते
they
हैं
can
वो
make the knee lock with the help of support. Today you could see the patient was standing himself.
डिपेंड खड़ा होने के बाद कोई बकलिंग नहीं होने का मतलब ये होता है कि पेशेंट का सारा नर्व और ब्रेन के साथ कोऑर्डिनेशन हो चुका है। यू कैन सी ए पेशेंट who was of spinal cord injury who could not even stand, a quadriplegic patient। अब तुम अपना हाथ उठाओ दो, गुड, ऐसे ले जाओ, ऐसे ले जाओ, लो, गुड, नीचे लो। थोड़ा दिक्कत होगा।
वो स्टैंडिंग के बाद बैठे ना आप, फिर हमको ऐसे करते हैं ना, वो सामने
You could see with the help of stem cell therapy, we have developed and
कितना साल में
then
चेयर पे
the procedure recovered a patient of quadriplegia.
4 साल बाद इंडिपेंडेंट खड़ा हुआ है, इंडिपेंडेंट खड़ा हुआ है कि नहीं हुआ ये पहले बोलो। हाँ, let's do what I teach you. See, you also can surpass anyone. Only you must have a good intention and knowledge. And what? तुमने बोला था इसको कैसे खड़ा करेगा, क्या खड़ा करेगा, कैसे करेगा, तो सिखा दिया। और तुम इसका जैसे अभी चलाया है,
जी।
वैसे तुम इसको रोज चलाओ। हाँ,
हाँ सर,
रोज वॉकिंग कराओ। उसके
You can
बाद
see his previous photo.
ये
See his previous photo.
अपने आप चल जाएगा। वो नीलो का लाया है ना, इसे
Go
मैंने
to
बोला
previous
था,
photo. See. Second photo. How much changes do you see? Within 2 months.
Without brace, sir, lots of improvement. It means
He is able to walk now.
he's totally independent.
Yeah, he is able to walk with mild ground clearance.
Yes, sir.
See, one thing I want to tell you. What was the role of physiotherapy? Tell me. And then what is the role of physiotherapy?
To regain the ADL activity of the patient, which he or she previously lost.
You are right. And where are we?
Process is very long, sir. Even we can't say.
Now, where are we now? What is our status?
Sir, you're.
Our means not physiotherapy status.
It's still till now date we can't say the patient can totally independent. The patient is
See,
still
the question
on
is what
care.
you know. You all never studied how to revive a patient. Did you study?
We just follow the some techniques, some things.
Yeah, techniques. I always say apply your mind.
I read other techniques. I read what he says, but I apply my own knowledge. This boy today, KFO was we ordered for a KFO. We thought he was so afraid. He might not even stand. His father was thinking of binding everything. But he was crying today and he was saying, the son is walking. Tomorrow you will see with KFO he can walk.
Yes, without KFO walking, it's really a great achievement.
With mind down clearance you will be able to walk. With KFO.
Hello, I
Even
may speak something.
Tell me, sir.
Sir, in paraplegia and quadriplegia, our basic aim is to maintain normal anatomical position, avoid formation of contracture and deformity. Besides that, pressure sores, bladder and bowel training, along with the residual muscle strength whatsoever was were not denervated, better to say, where some motor power was there to rebuild. It is basic principle to treat such paraplegic and quadriplegic patients. Moreover, activity of daily living, frequent turning on bed, like that. But in this case, I have observed practically when there is complete transaction of now the spinal cord at any level, below one level, all the sensory and motor power is lost. Whereas this is miracle. What I have seen using acupuncture, then this claim on one side there is no regeneration of these neurons and nerve cell tissues. Whereas in this case, when patient is holding, balancing, and doing all the things, thrust is there. The previous study is not to be accepted as such. Now it is to be again accepted in new limelights, whatsoever you did it, and what acupuncture science and other latest medicine, so-called alternative medicines are introducing for the improvement of patient. This is my personal observation in last 40 years of my career as physiotherapist in various organizations, even though I had worked in spinal injury center also at many places. So it's my personal observation, and you know better about such
Can we
cases.
think that a quadriplegic patient up to yesterday did not, up to 5 minutes back, he did not have the confidence that he will
Such
stand. And he started walking
quadriplegic,
after 5 minutes. Even
such
my
quad.
physiotherapist did not have the confidence.
No, no, sir, I may like to know कि as far as quadriplegic patients are concerned, they don't have sitting balance and even neck control also. Standing is a very big thing for them. Putting them long, this full bilateral full length calipers in my time when I was student, we were taught like this: bilateral full length caliper with pelvis band and spinal support, along with a brace that also immobilized spine as a whole. It was given, but using this finger movements, this grip, lateral grip, prehensile grip, very poor in quadriplegic. But in this case, I have seen walking on parallel bar. It's a very nice, a great achievement. We should admit it and admire it openly. By using this TCM, traditional Chinese system of medicine, we are doing something else, something
No, we
better.
did not use PCM, sir.
Uh,
We
you
use
are
brain.
using
That
NIBS,
is what I said. No, I
NIBS.
used brain and equipment. We have developed another
Uh,
technique called brain and equipment.
you use to stimulate for the axon.
You can stimulate with different techniques, right?
You use that technique, and we should accept, recognize that technique. This by using this technique, we can do something better. And additional work.
నన్ను ఆఫ్ చేసేయాలి లైట్ కూడా
Sir, it's okay, and you please continue.
Any more questions regarding this thing?
Sir, I have a question.
May I know
With
speaking?
Anand Maurya, sir.
Monia ji.
Sir, how much the improvement is possible without stem therapy?
This stem cell therapy is only 4,000-5,000 rupees cost.
Yes, I am agree, but when
Stem cell is required in all these cases because the conduction of it is very difficult. We have tried our level best with all our previous cases. We are fed up with 6 months to bring this recovery. How much?
6 months,
Yeah.
that means recovery
And
is
then this
possible.
recovery we got less than in 1.5 months.
Okay, means without stem cell recovery is possible, but it takes long time.
Yes, the recovery takes very long time. And stem cell is what? Just take out the stem, process and insert. Topic over. Conduction. Main is a conduction nerve, interneural communications. And it is
Yes,
very fast.
it's possible, but it is not cheaply available everywhere.
It is very cheap. In our clinic, it is less than 5,000 rupees, 6,000 rupees.
It's yes, yes, it's only with you, sir.
Ah,
What about the other hospitals?
well, I don't know. We give it in 5,000 rupees.
Yes, that's why then we can refer the patient.
Our clinic is a charitable clinic. I was amazed that person, your colleague, did not call me. Otherwise, I would have made a very good drawing how to recover his mother. But then I thought that he's changing his pathway. And so I did not go further. Otherwise, recovery of his mother was very easy. Sometimes you should give time because I did not see the patient, right?
Yes, sir.
But when you don't have faith on us, so what can we do?
We have faith, sir. We are there and
I'm
apply
saying about
some
your friend.
practices. I already pass message each and everyone individual. They not attend the class. Then what I can do, sir?
Ah, now you understood why recovery is difficult. Because our basic knowledge is not correct. What is the basic knowledge? The neuropathic conditions has to be recovered. And that has to be measured by NCV. I purchased a NCV and we measure their nerves. And whichever nerve is weak, we insert needle and then we stimulate it at a regular level. And then we saw the miracle today. Why we need to, I covered another patient today, a 25 years old paralysis patient. I'll show you one more case which we have done.
Gee, one question.
Sir,
Yeah, is this same as the MS?
MS means?
Malati?
No. It is a spinal cord injury.
Mhm.
In
So-
MS, there is a demyelination, there is a cord lesion. Here the cord is injured, there is a transaction. The cord is broken into two pieces. So there is no treatment in Singapore or else in the world to make him stand in this position.
Right.
Even in NUS university, there is no situation by which they can make the patient stand like this.
Is there any way the orthopedic can suture back the spinal cord?
Even switcher is switching the spinal does not start the interneural communication.
Mm.
They have already done this in this case, but this boy was 4 years on wheelchair.
Good job, sir.
Sir, is there any data percentage patient improved through stem cell therapy?
See, all these things I have written in my books,
So there
and I
is
am continuously editing. Problem is we have a lot of patient pressure and work pressure. I am a single man who has to do many things, although the work power is there.
sir, you are
But it is
absolutely
very
busy, man.
difficult because the cases are difficult you are giving us.
Any data,
You see,
some
I have to
data.
study. You see how much MCV studies I have to study every day.
It's okay, sir. Data of total recovery with stem cell therapy, so that I may be able to write down an article in local newspaper for the general information of the masses. They may go and get treated as per their own financial position and status.
No, our cost is very less, sir. Stem cell outside is 3,50,000. Our 10 times is 50,000.
You are a charitable organization. Basically, in private sector, they are charging lakhs of rupees. In PGI, Chandigarh, they did stem cell therapy. Stem cell is a master cell. It takes the work of that cell wherever you want to throw it, and it will take the property of that cell as per need and requirement.
Yeah, it will
But-
need an requirement of that cell. It will take, even
Yeah,
it
yeah.
helps in CP children's.
Yes. So it's a neural arch development during when the child was in the mother's womb and the child zygote start developing like that. From there, this concept started long back. I'm not well versed in that genetic
No,
theory and
see, for
psychology
3
theory
months,
like.
4 months, I was against stem cell, you know why? Because of its cost. But when I analyzed how it is made and how I studied all the research papers one by one, historically I studied many papers. Then I realized, oh, it can be made like this. Oh, all men can afford it. The biggest beneficial is me. I was discharged from the hospital with the blood pressure of 20. My BP was 20.
Also, for recovery in
And the
medical
hole
science,
inside my heart was repaired. There was a
once
hole inside my heart. It was repaired.
Sir,
And now
once
you see one more patient I'm going to show you today who has recovered after 25 years of his paralysis. How many years?
25 years, it's a miracle. It's a miracle. Okay, sir, please continue. Otherwise, I am wasting your precious time.
No, you are not
Sure.
wasting the time. We are just trying to see, until or unless you understand the results, your interest will never come to studies.
Hardly I have studied.
Our class here is to discuss our knowledge. What is your knowledge? What is my knowledge? It is not a combined class. It is a combination of knowledge. You have
It's
a
a
huge
matter of
experience.
it's a matter of understanding from each and every person at any level.
Yeah, because earlier my faith was not there. But when an orthopedic surgeon came, he gave me an idea. And when I studied so much, I realized why they charge so much. They say it is a profit.
They are commercialized people, sir. They are commercial, absolutely commercialized people and money maintaining techniques. They are in rat race.
And I was thinking, how to insert stem cell inside the brain? I think it is not possible. Even with the best techniques, with the very fine needles, you cannot do it. Because if you do any hematoma inside the brain,
Sir, injecting anything in brain is very risky and it will lead to very, very adverse results.
I was just studying what the whole world is doing, what others are doing in Mumbai. I do not know.
Sir, I know.
I'll show you one case just now before we go.
I've seen that one. That's why
No,
just
now I'm just uploading. It is just uploading. We just wait. With the 25-year-old paralysis patient walking comfortably.
Yes, it's a miracle. That's why I said after 25 years, he started walking, balancing and all the things, extensor thrust, all he developed like that. As per our developmental physiotherapy, if a patient is unable to walk, start weight bearing up to the age of 8 or say 10 years, then it's very difficult to make him stand and walk. For last 25 years, he was on the bed. And now he started walking with the help of this stem cell therapy. First line of
What we do is we integrate everything. We integrate allopathic system. All the allopathic doctors, they integrate. Orthopedic doctor give intra-articular stem cell. And that also in 500 rupees.
it's a multidisciplinary integrated approach for human welfare.
Yes.
That's why they recovered. We are treating human body in parts just like car. Holistic somebody else, denting, painting somebody, electrical, mechanical like that. But human body react as a whole and to be treated as a whole.
I'll just give me 1 minute. I'll show you a case which I recovered today of 25 years old paralysis.
It's a miracle, sir. 25 years a long time, very long period.
And he was given a high dose of anesthesia, and since then he became paralytic. And then you can see his life. He came to talk to me. I said, can you give me 10 minutes? He asked the auto to take 10 minutes rest. And then in 10 minutes, he recovered by 70%.
A good recovery. Even 50% is very, very good recovery. 70% is too much.
Sir, in 10 minutes.
It's a very big achievement.
So there
Very,
is no
very-
word like miraculous in Shastri's dictionary. The skill and dedication, sincerity.
Sir,
I'll
please
show you that
continue.
video. Just give me 1 minute. Let me see it is uploaded or not. See, your interest will only come when you will see a patient recovering. When you see the results of the treatment, then only you will be able to understand.
Sir, prognosis is essential and prognosis is approximate expectation of in the recovery, what we can achieve. But if we achieve something more than that, it's a miracle. Or literally, it's a miracle. After 25 years, where lying on bed, patient start walking and standing like that.
Well, he was paraparesis, but he was unable to, and it's very difficult, very painful for him to see how he walking.
Paraparesis is different than paralysis, paraplegia.
No, he was not paraparesis, hemiparesis.
Hemiparesis is different. Half side, paralysis of half side of the body Region may be CVA or brain.
Yeah,
related
because
to
you were
higher
injected,
centers.
yeah, 5 years you were injected a high dose of anesthetic drug. So be careful. That is why I'm always afraid of injecting anesthetic drug and all. So that is why I take out more easy and easy procedures every day. I study allopathic system. I try to convert it into a different system. Can we do it in our clinic or not? I saw. Can I convert what stem cell with the help of prolotherapy? How much rotation is required? How much this is required? Whether the prolotherapy and stem cell therapy is same. I saw a lady who was having a very severe pain. I showed you the video. Her pain is no more now.
Okay, sir. Well wishes are with you. Please continue. Besides taking help, care of your health and stay blessed. Please continue the work. May I disturb
I'm just waiting. Yeah, you can see the screen. I think. Wait a minute. I'm just going to show you the video of 25 years patient, and then
Sir,
we'll
let me
discuss
learn.
about.
Let
Wait
me
a
be your
minute. Complex
student
pain we'll
and learn
discuss
new
later
things.
on. See, these things you cannot practice. I have seen. Complex pain, these, you may not be able to practice. But if you understand the basic concepts, you can practice very difficult techniques in a very easy way.
Depends upon the teacher who is teaching those difficult techniques in an easy way. How to implement in a easy, very easy manner. Always depends upon the teacher.
In my clinic, I never use balls, I never use anything. CP child only inserted one needle. Autism is recovered only with needle.
Sir, please allow other person to ask questions. I am over.
Anyone is willing to ask questions till the video is uploaded? Any questions, please? Shastri, you can see a patient of 25 year of paralysis. 25 साल पुराना पैरालिसिस है आपका?
हाँ हेमफीलिया
25 साल पहले कैसे हुआ ये आपको?
एक डॉक्टर ने लोकल एनेस्थीसिया के लिए गलत सिडेशन दिया था।
हाँ
सिडेशन दिया था 2 ml सीक्वल, 1-2 बूंद देने की प्रैक्टिस थी, वो जानता नहीं था, उसने 2 ml दे दिया, जिसके चलते सीवियर हाइपोटेंशन हो गया।
हाँ
और बाद में जो थ्रोम्बसिस हो गया उसको गलाने के लिए जनरल एमडीज ने एक ही इंजेक्शन दिया था, उनको दूसरे इंजेक्शन देने की हिम्मत नहीं हुई। और न्यूरोफिजिशियन तक लाते लाते मेरे को 48 घंटे पार हो गई। न्यूरोफिजिशियन ने कहा कि वो रिकवरी अब काम नहीं करेगा, जो अब जो हालत में है वैसे ही जिए हुआ, बस फिजियोथेरेपी से जितना रिकवर हो सकते हो बस।
Stop it. I'll tell you what the patient said. Patient said that he was given a high dose of anesthesia 25 years back. Then he was given another injection. Physician, until they reached the neurophysician, he said, whatever condition you have is there. You will not change for 25 years. You will live like this only. The condition was bad. And now you can see a significant recovery of the patient after 25 years of his paralysis. Now you can hear the statement. And you will see the results also. हाँ अब चेक करो।
बॉडी लूज कर दीजिए सर बिल्कुल आप।
हाँ ठीक है।
अभी थोड़ा सा सर पहले से डिलीट हुआ है, और फर्स्ट टाइम जब किया था हमने अभी विद इन 2 मिनट्स पहले तो पूरा स्टिफ था सर। ना ही प्लांटर फ्लेक्शन आ रहा था और ना ही डोर्सी फ्लेक्शन था। लेकिन अब जो कर रहे हैं तो थोड़ा रिलीज हुआ है सर।
अब देखो अब देखिए कितना है।
कॉन्टेक्ट करिए बोल रहे हैं। हाँ सर, रेंज इंक्रीज डॉर्सिफिलेक्शन
वो आगे से आगे।
या
हो गया?
देखिए मैं हिला रहा हूँ।
यस
हाँ ठीक है।
मैंने क्या कहा था 15 मिनट में मैं चेक कर दूंगा। एक नीडल और देना।
What a bike place.
अब देखो
एक्टिवली मूवमेंट हो रहा है सर का एंकल मूवमेंट। यस सर करिए आप। यस या यू कैन सी एक्टिवली प्लांटर फ्लेक्शन एंड डोर्सिफिलेक्शन एंकल मूवमेंट।
अब देखिए आ रहा है या नहीं आ रहा।
सर आप फील कर रहे हो आप मूवमेंट?
हाँ फील कर रहा हूँ।
25 साल में आया ये मोमेंट।
ये बोल नहीं सकता हूँ, नहीं है यार।
हाँ
काफी दिन से जमा हुआ है ये।
Sir,
काफी
no,
दिनों से।
जमा हुआ है ना।
no video, please.
अभी कितने टाइम बाद आप फील कर रहे हो कि मेरा एंकल मूवमेंट ऐसा आ रहा है?
ये अभी
अप एंड डाउन
अभी अभी हो रहा है।
कितने टाइम बाद सर?
ये अभी इन्होंने कहा ना ये। अच्छा ये कब कब से ये डिफरेंस कब से है?
यस यस
ये मैं नोट कब किया पता नहीं था। एक बार गिरने वाला था तब से नोट किया हूँ कि एक जमा हुआ है ऐसे। साइड मूवमेंट
एक्चुअली साइड मूवमेंट ये पैरालिटिक मूवमेंट से ही है।
यस सर।
आपको ये 25 साल से ही है।
हाँ हाँ।
He's a 25-year-old
किसने बताया
paralysis
मेरे बारे
patient.
में?
चंद्रकांत है डेंटिस्ट मालूम है।
हाँ
उसने कहा था आप थोड़े हैदराबाद आ जाओ। वो काफ़ी दिनों से पोस्टपोन कर रहा था। वो हमारे लड़के का दोस्त है वो। मैक्सलो फेशियल सर्जरी करते हैं वो। बाकी तो क्लिप वगैरह लगे तो ओके एक झटके में सर्जरी के लिए दांत ठीक कर देता है वो।
हाँ
वो महावीर हॉस्पिटल में बैठते हैं
हाँ
डॉक्टर चंद्रकांत।
हाँ।
उसने कहा था। और बाद में मैंने आपका वीडियो वगैरह देख लिया यूट्यूब में।
यूट्यूब फेसबुक।
हाँ
हाँ अब देखिए
जी सर एक्टिव मूवमेंट
कोई मूवमेंट आ रहा है।
या फिंगर मूवमेंट।
हाँ आ रहा है।
यस पर तो
आ
भी
गया?
मूवमेंट कर रहा है।
So here you can see I'm recovering a 25-year-old paralytic patient,
Yeah.
and now you can see globally his power is 5, and now you can see the spasticity of his calf muscles. तो calf muscle में कितना spasticity है?
तो पूरे स्पार्टिसिटी है का
क्या बोलना? So now you can see आई एम रिकवरिंग हिज फुट एंकल। आप कब से चलने में तकलीफ पा रहे थे?
वैसे
25
चले
साल
जा
हो गए।
सही चले जा रहे हैं जैसे चलता है
वैसे ही चले जा रहे थे 25 साल से।
बस।
अब 25 साल का चलना में 5 फीट में ठीक किया तो
अजीब की बात है।
So here you can see I am recovering a 25-year-old paralysis patient. बंद हुआ बेटा?
यस सर।
अब देखो मूवमेंट कितना है।
अभी सर एक्टिवली मूवमेंट करिए आप पूरा। यस, डाउन जाइए, डाउन पूरा। यस यस यस, पीछे तक लूज लूज। यस, अभी सर पहले से काफी रिलीज हो गया है।
हाँ, अभी हो गया।
रिलीज हुआ है सर।
कितना रिलीज हो गया?
30 डिग्री
30 तो बेसी हो गया।
40
ये अभी 70 कर देते हैं।
तो सर मूवमेंट करिए।
होता है उसके अनुसार कर लीजिए।
आपको वो पैसे देने की जरूरत नहीं है। डोंट वरी अबाउट मी। This is a 25-year-old paralysis patient, and here you can see how we recover it.
यस सर, गुड, वेरी गुड। यस गुड। फील कर पा रहे हैं सर ये एंकल मूवमेंट आप? या बोथ एंकल एक साथ करिए। यस, या वेरी गुड, गुड। यस, वेरी गुड, या वेरी गुड। रेज इंक्रीज हो रहा है सर डोर्सिफ्लेक्शन का।
और हो सेंटर में नहीं आया ना?
नो नो, लेटर रोटेट जा रहा है पूरा हिप सर इनका पहले से ही।
अच्छा लेटर लगे।
यस यस,
ऐसे करके चल रहे हैं।
या अभी सुपाइन पोजीशन में है तो जो इनका हिप है तो लेटर रोटेशन है सर। ये लाइक दिस लेटर रोटेशन एंड दिस मीडियल रोटेशन। तो अभी इनका ये है सर।
लेटरल रोटेशन को थोड़ा सा ठीक कर देते हैं। आशीष के लिए बेड रखा बाबू। अब देखो
सर अपना लेग को पूरा ऐसे मीडियल रोटेट करिए। या वेरी गुड। अब आया सब उसको तो अब फिर से करिए। यस सर।
No video, please.
चल के देखिए।
अब
करना पड़ेगा ना।
यस
अब उनको उतार।
चलिए।
So you can see a 25-year-old paralysis patient was difficult to walk. Walking. अब चलने में कितना आराम है। कितना आराम आ गया।
आगे से बहुत है।
चल के देखिए।
पहले से थोड़ा सा लाइट हुआ है चलने में आपको।
काफी लाइट हो गया।
काफी लेट है।
फर्स्ट टाइम देखा था तो आपका थोड़ा हैवी था पैर।
Sir, no audio, please. No video, please. No video, please.
There is some problem in your you reconnected. We all can see the video and audio.
मैं कभी सोचा था 25 साल बाद आप क्या सोचते हैं?
You log in and log out.
Yes, yes. Thank you, thank you.
और बाद में मालूम को इसकी बाद में
कितना इम्प्रूवमेंट लग रहा है?
ये फीलिंग फार बेटर.
Feeling far better after 25
Hello.
years.
Yes.
Hello.
You can see this a case, 25 साल पुराना
Yes,
paralysis
sir.
patient you can see can be recovered in just 10 minutes with the help of these few needles. ये photo ले लो.
Okay.
अभी कितना आ गया? चलिए. The person was finding lot of difficulty in walking. Now you can say walking fast. फटाफट चलिए. तो आप क्या बोलना चाहेंगे ट्रीटमेंट के बारे में?
सब कुछ सही है और बाकी जो मेरे बैलेंस खर्च ठीक कराना है इसके लिए आऊँगा.
इस ट्रीटमेंट के लिए आप क्या बोलना चाहेंगे? कैसा ट्रीटमेंट है ये?
अच्छा है.
विदाउट
You know?
मेडिसिन.
हाँ, एक्यूपंक्चर अच्छा काम किया है और इट इज वेरी इफेक्टिव. मेरा निर्णय ये है.
एक्यूपंक्चर ने ब्रेन स्टिमुलेशन किया.
अच्छा. हाँ,
कितना अच्छा काम किया ये.
अच्छा.
हाँ,
बहुत ही अच्छा काम किया. अच्छा लगा.
आप खुद उठ के देखिए. उठिए. अभी उठ पाते थे ऐसे? फिर बैठ के देखिए. हाँ, खुद उठिए. हो गया. So here you can see 25-year-old paralysis patient being recovered within 5 to 10 minutes of the treatment. Thank you so much. This is a patient who has arrived with very high peripheral neuropathy with walking disturbance. He could not walk. He almost came in a wheelchair with very high burning below the chest and the lower limbs. So, when you see the results, then you get interest in recovery of the patient. The neuroplasticity can be generated within minutes and seconds. You do and you get the results. Not only neuropathic cases. Very severe neuropathic case I have recovered in the hospital where I was admitted. So, already 8:35, I'll ask you to put your questions. You may ask your questions now. You have seen two cases. One is spinal cord injury, a patient who could not stand, and a patient who is self-standing. Another patient, for 25 years, he was paralytic, who could not even move with his ankle, is walking. What is your comment on this? Who came single-handedly just to meet me. What is your comment?
Questions, please. Any questions?
Yeah, G. In this second case, is there stem cell involved?
No, this is the first time, first day, first minute case.
Remarkable.
Stem cells are only given for long cases, those who have generated long neuropathic case. We check their NCV, it is below 3 or 2 or 3. Then we go for stem cell. Otherwise, we are not in favor of stem cell also.
So this one just came first day. Huh?
He just came to meet me for 5 minutes.
Yeah, very good. And you put how many needles? 3?
I gave him brain stimulation.
Yeah, is it 3 needles or
Hardly 4 needles.
4 needles? Okay, very good. Well done.
Questions, please. And I'm developing all this brain mapping for you also that it becomes very easy. Now I'm trying to develop those acupuncture points by which you put insert the needle and you get the results. So I'm going out of NIBS. NIBS is becoming outdated now. Although it is easy, but it is a lot of complications are there. Here we don't see much complications.
So you refer that to the acupuncture meridian on the...
No, acupuncture meridian is another technique which takes long time to recover. See, we first started with acupuncture meridian. We got 2 years to recover a patient. We were frustrated. Then we came out with NIBS technique. It recovered fast. But the problem was patient do not know how to walk. Power can come. Then get training, this. Again, lot of headache. But in this, we found that the training and everything can be done very fast.
Gee, your NIBS technique has helped me a lot in my patient. Thank you.
Sir, that means by applying this map that you are using, the muscles power,
This is
spasticity,
totally a different technique. Here we are
means,
using, I have found out certain points while I was studying, certain nerve impulses, right?
yes, sir.
Recover the very critical neuropathic pains of cancer and all.
Means through this area you can recover the coordination, spasticity, power, all these things.
Yeah, that is what I'm saying. Primary thing for a physiotherapist is to revive the patient to this extent in a limited time period. Because if you don't do 10 years, remember this boy has wasted 4 years of his life, right?
Yes, sir.
If you would have learned all these techniques 2 years back or 1 year back, how many years of these people's life can be saved? How much physiotherapy can be glorified? Today, physiotherapy means 10 years, 12 years, 15 years, 5 years, 6 years. And I want to bring physiotherapy in 2 months, 3 months, so that you have number of patients.
Sir,
Ah.
do you mean it isn't kind of a blessing sculpt as previously done?
No. There is nothing to do with blessing skull. I've again changed it. I made it a different type of acupuncture. I call it as a brain stimulation through. I got it brain acupuncture because giving more terms will always confuse it. So I called it brain acupuncture. Now, so much regulation, this, that. questioning, police questioning. So make it what? Simple thing, brain acupuncture technique.
Okay, waiting eagerly to get it done, to get it learned by you.
See, what thing is what it is hardly matters for the patient, right? And what it is for you also hardly matters. Patient is recovering or not, that is matter.
Yeah, I hope we can learn the technique from you. Thank you so much.
It's very easy technique. You can use your fingers and just you can point out the points and insert the needle and just click and tuck. Topic over.
But sir, how we can find out?
That's all what we needed to learn. First of all, the thing is that the whole way of teaching our technique was wrong. Whole it was maintenance technique. Whole technique was a mixture technique. Do exercise, do more spasticity. Did you ever study? Paralysis is based on NCV study.
Yes, sir. NCV test is performed in some hospital,
Yeah,
but what,
we purchase the NCV test and every alternate day we do NCV test.
but in my personal patient means after attending your workshop, I found that there is a lots of changes before attending the workshop. I treat some NDT techniques and some other where we develop some new pathway. After joining or completing your training, then I found that the patient already have the memory to walk. Then I reconnect the pathway. Then patients definitely their foots, their knee, it's automatically going to move.
Yeah, and tell your friends that yes, 25 years old patient can walk so easily in just one day.
But
When he
sir, it
came, his
is
power was hardly 1 or 2. Now you can see he's walking like this.
yes, the patient already have the memory to walk. We connect it. But today you
It is
show
not
the
the
case.
memory. See. The question is not the memory. The question is the neurons which had the memory has been lost.
Okay.
What happens in the brain is very difficult to say when we put this impulse. But we can say that a neural connection starts and suddenly a spark in the brain. There's a book called Spark in a Machine. From there I got inspiration. A spark in a brain can create a neuroplasticity inside the brain. It was just like me. I just wanted to recover so fast. I recovered in one day, whereas the patient take rest. I directly came from the hospital and joined the clinic. I did not take a single minute rest, discharge and duty. Whereas my blood pressure was how much? 20. Dystolic was 20. And now you can see from yesterday to now how much I am changed.
Yes, sir. Lots of improvement.
Gee, how you managed to get from 20 to 1?
How?
20 to 1, your pressure. Your
I did not
systolic was
understand.
20, right?
Yes. See, all they thought that I had a heart attack. They thought that I had this one. But then I always carry my acupuncture needle in my pocket. I have a habit. I inserted immediately my acupuncture needle in my scalp without their knowledge. And I induced the adrenaline flow. They gave me new adrenaline and I inserted my own new adrenaline. And within 2 hours, they withdrew all the adrenaline. 3 hours. Yeah, they told me to go join take rest in one hospital. I said I'll join my work rather than taking. And by afternoon I was free, and today I've seen the whole day 80, 90, 100 patients, and I'm perfectly taking with you.
Blessing, blessing.
Sir, about the 25 years old paralysis patient, what has the patient done during those 25 years?
He was, he lived a very, you can see what was his pathetic life. He was totally frustrated. He did not even give me time to question him anything, right? He was worried how much money I will ask him.
Hmm.
He just
Oh.
came to see the place. I said, do you have 10 minutes to give me?
And of course, he said yes.
He said, 10 minutes? I have given 25 years. Yes.
Oh.
So, that's why I say people, recover as much as you can. Because now if you see the results, tomorrow when you read the book, you will understand that yes, through this procedure, this recovery is possible. After 17 June, again we'll have a free course. That's what I say. People should try to recover. People always try to become sick. What I will do? They have made their life a pharmacy. They gave me yesterday 6 medicine. I'll take. I said I'll take not even one medicine. I'll take. I came. I took IV fluid. I took glutathione and all, and now I took. I'm fit. So this is my advice to you, that please try to do what? Because when you read my books, you won't be able to understand when you don't understand these things. These are the primary things which help you to recover large number of patients. More questions? More questions?
Excuse me, sir. So can
Yes, madam, please tell
yeah,
me.
can stem cell help in cancer patients, sir, to recover?
See, cancer cannot be recovered. It can be survived, it can be sustained, it can be prolonged.
Yes. Thank you, sir.
More questions? More questions? Please take the attendance so we can issue their certificate on time.
Sir, why you inserting a lot of needles is just to attain the optimum potential, optimum action
See,
potential.
no. I don't insert lot of needles. Maximum needle I insert is 10. Rest if the patient request, I give a placebo. See, see, who is a physician who recovers with 1 or 2 or 3 needles?
Yes, sir, I am agree with.
Is a drama.
Video is stopped, sir.
Can you believe single day can I be discharged in such a critical condition?
No, it's not possible.
Did you believe?
No, sir.
When the blood pressure is 20
No, it's
and with
not
new
possible, sir.
adrenaline, it's fluctuating with new adrenaline. They put syringe pipe, they were going with central line. Now where is the central line? From there I realized, oh, with the help of this scalp acupuncture, we can do a lot in cardiology also. Remember, things can only be achieved and perfection can only be achieved when you have patience to learn. And every day when you think, you learn something new, you achieve and you get a new pathway. It's just what? Skin and nothing else. But just how to insert a needle and just changing the direction of the needle and stimulating it with this different pain. Wow, the results are achieved. Imagine within 10 minutes, 25 years old paralysis patient is recovered. I used advanced brain stimulation. Liam asked me what was the pain which I used. I used advanced brain stimulation. Any more questions? Thank you, all of you.
Thank you so much, sir.
Thank you so much,
Thank
sir.
you so much.
Thank you, sir.
Thank you.
Thank you, sir.
Take
Thank
care,
you.
Ji.
Thank you.
Thank
Nice
you, sir.
Thank you, Ji.
Okay.
Thank you.
Namaste, Ji.
Thank
Pranam,
you,
Ji.
sir.
Thank you, sir. Thank you so much, sir. Thank you.
Good night, everybody.
Thank
Thank
you
you,
very
sir.
much.
Good night, sir.
Good night.
Good night, everyone.
Assalamu alaikum.
Thank you.